Hi, this is Dr. Jaitly. This is the number 3 presentation on syncope. They're all in sequence, as you know. So in the first one, we talked about what is syncope and what are the causes. In the second one, we talked about the major cause of syncope as loss of blood volume. In this section, I'm going to talk to you about what are the other causes of syncope, Syncope, which is transient loss of consciousness with full regain of consciousness after the episode is over. And normally the episode lasts few seconds to several minutes. A very important cause that's going to be discussed in this section is the weakened heart muscle. Obviously, the immediate thing that comes to your mind is the heart failure. That means the heart is not able to meet the needs or the demands of the body for that level of metabolism or that level of energy requirement. And that is called heart failure. Now that may result either from a failed left ventricle, which as we know is a booster chamber and that is not contracting too well, or it could be because of increased demand and the heart is not able to pump to meet the needs to fulfill the oxygen requirements and thereby supply the brain with adequate oxygenation. So that's the principle behind heart failure and the weakened heart muscle, resulting into this transient loss of consciousness called syncope. Next, move on to the next one, is the increased peripheral vasodilatation. What do we understand by that? The arteries and the veins, remember in the legs, they could vasodilate either because of a severe blood infection, we call it severe sepsis, or it could be because of certain vasodilator drugs that have been prescribed, and sometimes it could be a reaction to the arteries or to the veins. That means there is a lot of blood pooling in your legs, and as a result, not much blood is going to your brain, and the patient will pass out. Remember, you only have as much blood volume in your body, but if a lot of it is sitting in your legs uselessly and not getting to the brain where it's required, the person passes out. Very rapid heart rate. When the heart rate is too rapid, it's called tachyarrhythmia. When the heart rate is too slow, it's called bradyarrhythmia. This is a misprint here. It should have been slow. So anyway, the key is that we understand the bradyarrhythmia and the tachyarrhythmia resulting from a very rapid heart rate or a very slow heart rate, leading to not be able to pump adequately. Remember, if the heart is going too rapid, it's not filling in too much to eject too much or enough to the brain. So that's an issue. And then if it is going too slow, it's not meeting the needs of the total amount of blood that should arrive at the end of 1 minute or 2 minutes to the brain. So either way, the heart is not pumping enough to keep the blood circulation going well to the brain, and that results into syncope. The autonomic nerve dysfunction, that is a very, very complex set of nerves within the base of the brain, which require us to be awake, which require us to be asleep. And whenever there is an imbalance between them, more towards the lethargy or sleep, it will result into autonomic nerve dysfunctions. That could be either because of brain disorders, it could be because of strokes that can happen, or patients can have a seizure or epilepsy, and many and not uncommonly one sees poisons like illicit drugs and alcoholism. They have been involved because they can destroy the nerve centers and sometimes subdue the nervous system so much that the patient can pass out for several minutes and actually get hurt or be unconscious for a long time. So these are some of the causes that I've just enumerated about syncope. So one really needs to sort of start looking at the right scenarios in which the causes are found in that particular individual based on the history and the physical examination. That will lead you to know what are the causes of syncope. And as I said, cardiology is very intriguing, but my job is to again keep it as simple as possible, but once you start looking at these causes, I'm sure one would understand that syncope is a very intriguing subject, because when you come across a person who has lost consciousness, you really need to understand what was the cause of that loss of consciousness in that individual, because the treatment will depend on the cause of the loss of consciousness. Okay, hope you found this very intriguing subject interesting enough. And as I said, my job is to keep it as simple as possible. Hope you enjoyed it. Thanks again. See you again. Bye.